Despite being treatable and curable, tuberculosis, or TB, remains one of the world's deadliest infectious diseases, causing an estimated 1.3 million deaths in 2022, according to the latest World Health Organization figures. That's a reduction of around 19% on the previous year. But there was a small increase in the number of cases to an estimated 10.6 million. Some 40% of people living with TB are undiagnosed and untreated. The COVID-19 pandemic, which began in 2020, overwhelmed health services in many parts of the world, and TB diagnosis and treatment levels plummeted.
Unfortunately, the incidence through TB is growing. We used to have a decline of 2% per year. And then due to COVID, we have now an increase for the last 2 years, 21 and 22, of almost 4%.
The World Health Organization estimates COVID-related disruptions resulted in almost 500,000 excess deaths from TB in the 3 years from 2020 to 2022. The report also reveals a concerning lack of progress in some areas.
A pretty difficult situation on people with drug-resistant TB as well as childhood TB. So drug-resistant TB, just short of 200,000 people were diagnosed and put in treatment. And exactly as WHO said, 2 out of 5 people with drug-resistant TB had access to drug-resistant TB treatment.
But the fight against TB is getting back on track. The number of cases diagnosed globally last year was 7.5 million, the highest ever recorded.
This shows that the countries buckled up to recover after COVID and even jump above the level before COVID.
A promising TB vaccine made by GlaxoSmithKline is currently in the final stage of trials, and more than a dozen other vaccines are undergoing testing.
We need a vaccine. So that will be the game changer. What it implies, I tell you what it implies. It implies to have either a vaccine that works perfectly on different age groups or several vaccines to complement each other.
The 19% fall in deaths from TB is still far short of the World Health Organization's target of a 75% reduction by 2025. Funding also fell short, reaching less than half of the WHO target of at least $13 billion for TB diagnosis, treatment and prevention services in 2022. Governments committed to spending $22 billion a year on TB by 2027 at a special UN meeting in September. Henry Ridgewell, VOA News, London.